We're fortunate to have you, Dr. Chelsia Harris, not only being a doctor and nurse practitioner, but also being a registered nurse and working in the academic system as well, which is a lot on your plate. I'd love to get your perspective, and if you have a question for any of our panelists.
Absolutely. Thank you so much for having me, and being in the nursing profession for almost 20 years now, and much of my research actually being in what is called the daily spiritual experience, which actually measures a sense of awe, as well as burnout and compassion fatigue, which are elements in the healthcare profession. And I do know with our brothers and sisters in law enforcement, some of those other first responders as well. And so I tend to lean towards the existential awe and the components of that, and that more positive kind of perception there. And so as I was listening to all of you speak, there's so much to take away today, but Dr. I believe it's Valdesolo, I hope I said that correctly. You mentioned about the supernatural versus the scientific. And in my own personal research and professional research, I've found that daily spiritual experience, which has that component of a sense of awe, has actually been supported as a protective mechanism against burnout and compassion fatigue, many of the things that we as healthcare providers experience in our day-to-day. And so you mentioned about that in your research, that awe often would increase theists' beliefs in religion as an explanatory framework, and that awe would decrease theist beliefs in science. And then you had this moment where you said the effect of awe on non-theist attitudes is a little less clear. And so you moved on to talk about defensive versus constructive, and that position of curiosity. And I'm wondering if we have a person who is in healthcare, or our first responders, or our police officers, why should we desire to move someone toward a more constructive position, or any position, if they're already in a healthy state of awe, if per se they're in the supernatural or existential form of awe? I'd just like for you to speak a little bit more about that, please.
Yeah, absolutely. So it's a great question. Yeah, I try to be very careful whenever I describe my research or my results, not to suggest that one direction or another is a more desirable outcome, right? So as a psychologist, I really try to say, here's what we found, here's what happens with this psychological profile and this psychological variable, not to say, and that's good, and this is what we should want. So to the extent that the kind of openness and curiosity and more exploratory position is something that we want, then under those circumstances, if that's what we want, then I think regardless of what your initial explanation is, whether it's theistic or not, moving people away from what I would call their default explanations is what you're going to want to do. So I didn't mean to imply that the desirable outcome is one way or another. I think that for any individual, any practitioner, they need to decide, okay, what is best for me? What is best for my patient, given my knowledge, my expertise, the context that I'm in, and then use this science to guide your choices. If you believe that for you or your patient in your context, moving away from how they tend to explain the world will be better for them or for you, then by all means, foster the kind of constructive awe that Dr. Schneider and I were discussing. But if not, then you might not want to do that.